Hello, everybody. Welcome back to our interview series with physician leaders. Today, I have the honor of speaking to Mark Schnitzer. Welcome, Mark.
Thank you, Elsie. It's a great pleasure to be here.
Great. I'm so happy to have you here. He is an experienced physician leader and advisor. He's a medical director, and he's calling from Dallas, Texas. He returned to North America in 2016. He was actually called upon to go to the Middle East in 2012 from Hawaii. He went to Abu Dhabi to help build their neuroscience department. I found that incredible. And he's a neurosurgeon who was practicing in Southern California for 15 years. And he also has an electrical engineering degree. I mean, that's a mouthful. What are you doing now, Mark, in Dallas? You just moved there.
I did. I just moved to Dallas in the middle of February of this year to be the medical director for the Baylor Scott & White Quality Alliance, which is the accountable care organization associated with Baylor Scott & White Health. It's a fantastic job. I love Dallas. It turns out, though, that I was here only for a few weeks before COVID caused us to be locked down. So the vast majority of my time has been in my home office.
That's amazing. I want to tell everyone that I did speak to you briefly before, and you told us about the cultural diversity in Abu Dhabi within the leadership teams. Have you had even a chance to see what your leadership team is like at Dallas right now? I mean, I know you've been on camera, but.
Right. So Dallas, Dallas in general is a very diverse place. And that's wonderful to see the talent expressed independent of any of the artificial distinctions that we apply. It's just talented people, men, women, different religions, different cultures, backgrounds. However, I can only see them on TV. I mean, on the computer screen.
Right.
So socializing has been a challenge.
Right. With everything that's going on right now with, Black Lives Matter and diversity and making sure there's equal rights. I know we had conversations about this before, and you recognize the importance in leadership of having a diverse group and really looking for that star who deserves to be on the top, is what you said, instead of, and recognizing that we all have biases in leadership.
Yeah.
I mean, I think what you said to me is, what do you say about, leaders need to recognize their biases, right? They have to be transparent about it.
Right. I mean, the first thing to do is to just acknowledge what's so about your own personality. There's just a self-awareness that once an individual acknowledges that, they accept self-awareness as an attribute they need to develop, then they reject those biases that don't serve them. Absolutely.
And that's why let's go into some of these traits of having a very successful leadership team. You talked about organizational values. You spoke about integrity. Can you speak a little bit about how you incorporate that into an organization?
Sure. So when I think of integrity, for me, integrity means honoring my word, and I choose that deliberately. I intend to keep my word, but I honor it such that if an occasion arose where I could not keep my word, I would alert the affected parties as soon as possible and make it right by them. So, for example, and the easiest way for an individual to honor their word is just in keeping appointments. If an appointment is an agreement, it is one's word to be at a certain place at a certain time, ready for a certain thing. And so late is a fracture of integrity. It's out of integrity. So And that goes a long way. Something that simple is emblematic of the whole organization. How important is a deadline or a commitment? And I think about values all the time too. I owe this to the writings of Patrick Lencioni. I want to make sure that I acknowledge that, because when I got hit in his writings, he distinguishes 4 different types of values. The values that we commonly refer to when we say values, we mean core values. And core values are those attributes for which an individual would agree to accept punishment rather than give them up. Core values is not something to delegate to the HR or business development to come up with. It is something that is intrinsic and inherent to the organization, that starts at the very top with the senior most leaders. And so following core values are aspirational values, which are those values that an individual or an organization might want to have, but don't.
So what
And
values are you talking? I'm sorry. Tell me some examples of your organizational core values for yourself. I mean, you might not recognize what it is right now since you just started this job, but
right.
What do you do as president?
So my own core value statement is, who I am is inspiration and freedom. And that's been my value statement for 10 years at least. And initially I had to be intentional about that. I had to think about it, but now it's so automatic for me that I don't do or say anything that isn't run through that filter. Everything I do and everything I say is intended to inspire or liberate. When I was a clinician, my intention was to liberate patients from pain, or liberate them from the anxiety of their tumor, or inspire them to overcome their disability. And then I was able to parlay that into teams. I want to inspire people to take on bigger things than they think they can do. If I see something in them, I want to liberate them from the fear of failure. The opposite of success isn't failure. It's not trying. Failure is fundamental to success. And the faster you can do it and move past, the more improvement you will have available to you. So those are core values. Aspirational values.
What are the accidental values you spoke about before to me?
Right. So the other two are accidental values and permission to play values. And accidental values are those values that are incorporated into an organization by virtue of adding people to the organization who have either not been screened or not been trained in the core values of the organization. So, if being on time is not a core value and not expressed as something that is the intention of the organization, and individuals are recruited and added to the workforce for whom timeliness is just not a thing, not important, then tardiness will be an accidental value. It's just what's so. And that's where permission to play values come in. Permission to play are those attributes that are necessary just to join the team. So when you think about a medical staff, permission to play is a medical license in that state. Yeah, I mean, in the absence of that, you can't play on the team. Now, what's interesting though is responsible stewardship is built into the medical staff bylaws of almost every medical staff that I've seen. but we don't hold healthcare providers accountable for responsible stewardship in many cases. And so the absence of responsible stewardship for healthcare resources becomes an accidental value.
Right. I love that. That's so good. Why did you leave clinical practice? What would you say to physicians especially in the earlier stages, their clinical practice, don't really understand that whole transition into leadership and why physicians leave and what are they doing there?
Yeah,
um, there's no
right.
understanding.
So that's a really good question. I love doctors, and I say that every chance I get. Doctors are really, really bright people, really, really hardworking people, and they've got so much on their hands and so much on their minds that the fundamental things that are necessary to operate an organization that's intended to deliver healthcare, or even the preventive care, it's just not available to them. They don't have the bandwidth to do it. So it's much easier to take a clinician and teach them the business side than it is to take an MBA with no healthcare experience and teach them the nuances of clinical work. So sometimes clinicians will look at a physician executive and in a derogatory way, that they'll say, "Oh, you've joined the dark side. You're not working with us. You're against us." And really, nothing could be further from the truth. Every single physician executive that I know does what they do to remove barriers for the clinicians to make the right thing to do the easy thing to do. And that's why I did it. It's really great. I mean, I could influence maybe 300 families a year as a neurosurgeon, and I can influence millions of people over the course of a year in my current role. It's spectacular.
Right. And you influence doctors' lives in their work environment because you're.
Well, I mean, imagine so yes, is the answer to your question, but not just their lives, but the lives of the people they love. If the right thing to do is the easy thing to do, and the doctor can make it to the piano recital and doesn't have to miss the date with their spouse, and things like that, some of those things are fixable with processes that doctors don't always get. Doctors in many cases are artisans. Nothing wrong with that, but being an artisan doesn't work well with processes. So it's important to have a handle on both.
Yes, and I think all physicians should learn a little bit about the business side or some leadership skills, because first of all, a lot of physicians fall into leadership not even thinking that they're going to do it in the first place. I don't know about you. Did you fall into leadership or was it intentional?
I sought it out.
Wow.
I deliberately did it, and just being a good clinician does not make you a good leader, especially of non-clinical people. There's teamwork that's involved. There's acknowledging people that's involved. There's creating a future in your language that you and the people that look up to you aspire to live into. It's not a top down like it might be in the operating room. It's a bottom up. The willing workers have to be touched, moved, and inspired to pursue a common goal. And so I sought that out. I sought that education out. I'm continuously learning, and it's very valuable information. I mean, people should do that.
I love that. That's so true. And that's why we need more physicians learning leadership skills so that they can speak the language of leaders and be placed in leadership roles.
I
The last
agree.
question I want to ask you, Mark, is the whole succession planning. What are you thinking about succession planning, and is it done enough?
So succession planning is such a vital component of running any business, and it comes up even in the criteria for the Malcolm Baldrige National Quality Award, which is, an award that many healthcare organizations aspire to receiving, and I'm blessed to be an examiner for that award. And what I see time after time in the applications that I've reviewed is the intention on behalf of senior leaders to identify replacements for senior leaders, but they do that often through some type of a curriculum for their nursing leaders. And they don't consider the doctors at all in the succession planning or the professional development of physicians, and the hierarchy, the governance of medical staff is who's going to be the next chief of this department. It is not who's going to step in when the interventional cardiologist has to be gone for 3 months because of something. That kind of succession planning is not trivial, because a healthcare organization can be brought down by the absence of one essential provider. So it's just important to keep in mind that doctors belong at that table, at least to have that conversation.
That's so true. Absolutely. We need more doctors like you helping other doctors too. So, Mark, thank you so much for this very short interview. Please tell us how people can reach you if they may at all.
Yes.
Or however you want.
So I really love personalized LinkedIn invitations. I really don't spend much time looking at canned LinkedIn invitations. So if someone thinks that I can add value to their organization, or if they think that they can teach me something, which I always welcome, please reach out to me with some customized LinkedIn invitation. And I really look forward to that. Thank you so much, Elsie.
Thank you so much, Mark, for your words of wisdom, and stay safe there in Dallas, and hope to talk to you soon.
Outstanding. Thanks, Elsie. Bye-bye.
Bye.